Jason Cornwell, Deputy Cabinet Secretary. We have the Director of NMBHI, Mr. Tim Shields. Tim, are you present?
Yes, I am.
Thank you, Tim. We have the Director of the Fort Baird Medical Center, Todd Windner. Todd, are you present?
Yes, I'm here.
We have the Acting Administrative Services Division Director. Ladies and gentlemen, I would like to introduce you to Mrs. Sylvia Serna. Sylvia, are you present?
I am present. Thank you.
Thank you. Director of the New Mexico Rehabilitation Center, Jose Garula. Are you present?
Yes, sir, I'm here.
Thank you, sir. The Executive Director of the Turquoise Lodge Hospital, Shauna Hartley, are you present?
I'm present.
Thank you. The Acting Director of the Meadows Long-Term Care Program at NMBHI, Derek Wheeler, are you present?
Present, sir.
Thank you. And Michael Jim, the Executive of the Las Lunas Community Program, are you present?
Present.
Thank you. Dr. Tom Massaro, CMO of the Department of Health. Sir, are you present? Okay. Michelle Fields, can you please resend the invite to Dr. Massaro? Text him, help him get online.
Yes, I'll do that right now.
Thank you. With the head count that we have currently, Melinda, do we have a quorum?
Yes, we do.
Members of the committee, members of the board, a quorum has been established. I will move to the agenda. I'm going to share my screen. Okay. We have just completed the call to order and established the quorum. We will now move to approve the agenda. You can see we've got 9 items to address today. They all substantially pertain to the Gibson Alternative Care Facility. May I have a motion to approve this agenda?
I approve.
So moved.
I heard it moved first by Shauna Hartley and seconded by Michael Jem.
Yes.
Thank you. We shall now do the roll call vote to the approval of the agenda. Melinda, I also approve of the agenda.
And should I go through the roll call?
Yes, please.
Dr. Massaro, yay or nay? Yet, has he?
Not yet.
Sorry. Sylvia Serna, yay or nay? Ms. Serna, are you muted? I wasn't able to hear.
Yes, I'm here. I apologize.
Do you approve of the agenda?
I do.
Tim Shields of NMBHI, yay or nay?
Yay.
Shauna Hartley, Administrator of Turquoise Lodge Hospital, yay or nay?
Yay.
Is Carmela Sandoval present?
I do not see Mrs. Sandoval present.
Okay, moving on to Administrator Jose Garula of NMRC, yay or nay? Michael Jam of LLCP, yay or nay?
Yay.
Derek Wheeler of NMBHI Nursing Home, yay or nay?
Yay.
And Mr. Todd Winder of the Fort Baird Medical Center, yay or nay?
Yay.
Majority yay. Deputy Secretary.
Thank you, Mrs. Walensky. The motion to approve the agenda has carried. So I will now move to what is the Gibson ACF? The Gibson Alternative Care Site is essentially an overflow site for hybrid care for COVID positive individuals. The goal of Gibson is to decompress hospitals so that more serious individuals who need those beds can be served at the appropriate level of care. Today we're going to talk about the Gibson guiding principles, how the Gibson ACF fits into the Albuquerque system of care, the Gibson ACF concept of operations, its scope of care, how we coordinate with local hospitals, and then we can take questions. There's coordination and collaboration with the local EMC, hospitals, shelters, and the Gibson ACF to achieve unity of effort so that we can function as one local system of care, the most efficient and effective way for our patients and our community. Unity of effort is key. It's critical that the ACF complement and integrate the local system so that the continuity of care for each patient will occur. Transfers between shelter, ACF, hospital, etc. Hospitals are best positions to expand surge and emergency capacity within their intensive care and medical ward capacities and capability within their existing facilities. When that cannot be done, or when that reaches an overflow status, it makes alternative care facilities like Gibson necessary. The New Mexico Department of Health will provide oversight for the Gibson's ACF in terms of its licensing. And the Gibson ACF's primary purpose is to create and expand minimal bed cot capacity to serve COVID-19 patients too sick to be at home and who need minimal care, and COVID-19 patients transferred from hospitals to receive additional care. The Gibson ACF is a new addition to the ABQ system of care. Each player has a key and complementary role. The system of care is for each one of us to understand its role and responsibility and the role and responsibility of the other members. Thus, communication and collaboration are necessary. It is necessary that we, individually and in the collective, work collaboratively as one system to achieve a common purpose, the care of our patients and community, one team. The concept of operations. Department of Health staff with Reserve Medical Corps and Workforce Solutions, we will operate the Gibson Alternative Care Facility. The facility will provide minimum care as defined for COVID positive individuals, and the City of Albuquerque Emergency Management Center will coordinate and provide transportation from the COVID positive patients between the hospital inpatient wards and the Gibson ACF. Hospitals will coordinate for the transfer of minimal care COVID positive patients. Every day at 11:45, Gibson staff meet with the care coordinators of the local hospitals to review potential discharges from the hospitals and intakes from Gibson. In the event that that occurs, there is a provider-to-provider discussion and a nurse-to-nurse discussion on each patient so that the Gibson ACF and the discharging hospital are on the same sheet of music when it comes to providing the care. Hospitals will accept Gibson COVID positive patients who may need to return for higher levels of care. So if Gibson has a patient on the ward who begins to decompensate, desaturate in terms of their oxygen, 911 will be activated and that individual will be transported back from the Gibson ACF to the closest, nearest local hospital for appropriate hospital level of care. The Gibson scope of care is thus: Gibson will provide minimal care for ambulatory COVID-positive patients who can safely be accepted from acute care, transitional, subacute care for low risk and recovering COVID-positive patients with limited nursing needs. The Gibson ACF will not have labs, nor x-ray, nor currently do IV therapy. There is no pharmacy. There's no on-site pharmacy. Patients must arrive with 10 days of their outpatient medication, glucometers, and supplies. There is a consultant pharmacist with a medical cart on the floor for the purposes of delivering common over-the-counter medications and emergency meds in case they're needed. And when I say emergency meds, I mean like an EpiPen. There will be no wound care needs, no indwelling catheter, lines, drains, or tubes. In the Gibson intake, the Gibson ACF will not be the initial point of intake for COVID-positive patients. Individuals will not be walking up and knocking on the front door to receive care. Gibson will not offer emergency services. It has limited ambulatory assistive devices. Staff will not perform any aerosolizing procedures. The anticipated length of stay is less than 7 days. Patient requirements. This is information that we review with the care coordinators from every hospital at 11:45 daily to see if they have patients that fit the profile that could be served at the Gibson ACF. Inpatients with saturations above 90% requiring 1 to 6 liters per minute of oxygen. They're ambulatory, COVID positive, with portable oxygen needing minimal assistance. The age range, 18 to 65, 66 to 80 years of age, with at least 10 days from onset, and they're improving. They can be independent with activities of daily living. And patients that have minimal medication needs. Patients that are stable on chronic oral medications, able to take and self-monitor. Individuals with diabetes with their personal glucose monitors are stable on no more than twice a day insulin. People with asthma who are stable on controller meds and 4 times a day PRN inhalers. The hospital Gibson coordination. There is a coordinator meeting Monday through Friday with Loveless, Press, UNMH, and Gibson, and the Albuquerque Emergency Management Center. The representative from ABQ EMC is Chris Ortiz. ABQ EMC provides the transportation, as I said in a previous slide. I also mentioned that there is hospital provider to Gibson provider coordination, hospital nurse to Gibson nurse coordination, and a discharge summary is faxed from the hospital to the Gibson ACF team. We require 10 days of outpatient meds, transportation coordinated by Mr. Ortiz through the ABQ EMC Sunvan. We accept transfers from 8 a.m. to 8 p.m. Monday through Friday. Are there any questions regarding the Gibson ACF, its necessity as a overflow for the hospital system, the scope of care, or how we coordinate from hospital to Gibson ACF?
Jason, is this for all adults or all age groups?
Okay, the age groups are from 18 to 65 and 66 to 80 with 10 days from symptom onset and improving. No pediatrics will be served at the Gibson Alternative Care Facility. Are there any more questions related to the Gibson ACF? Okay. Returning to item number 3 on our agenda, is there a motion to recognize the Gibson Alternative Care Facility as a DOH-operated temporary COVID care specialty hospital?
So moved.
Is there a second?
I second. This is Shauna.
Thank you. Melinda, we have a motion by Dr. Massaro and a second by Shauna Hartley. I'll conduct the roll call vote. You let me know if I miss anyone. Fort Baird Medical Center, yay or nay?
Yay.
NMBHI Executive Director Tim Shields, yay or nay?
Yay.
Administrative Services Acting Director Sylvia Cerna, yay or nay?
Yay.
Executive Director of Turquoise Lodge Hospital Shauna Hartley, yay or nay?
Yay.
New Mexico Rehabilitation Center Executive Jose Garula, yay or nay?
Yay.
Acting Director of the Long-Term Care NMBHI Program Derek Wheeler, yay or nay?
Yay.
Chief Medical Officer of the Department of Health Dr. Thomas Massaro, yay or nay?
Yay.
Executive Director of the Las Lunas Community Program Michael Gem, yay or nay?
Yay.
As Acting Deputy Cabinet Secretary Jason Cornwell, my vote is yay. Are there any members of the board that I missed, Melinda?
No, you did not miss anyone.
Great. I believe the motion was unanimous and the motion has carried. The next item on the agenda is the credentialing of the clinical staff who will then carry out the mission of the Gibson ACF. For this portion of the governing board agenda, I turn it over. I'm sorry, let me pause one moment. Carmela Sandoval, executive of the Sequoia Adolescent Treatment Center. Are you on?
I'm on.
When did you
Can
join?
you hear me?
Yes, ma'am, we can hear you. When did you join?
In the beginning, I just couldn't get my voice on. Sorry.
Okay.
Sorry.
Did you hear the presentation of the Gibson ACF?
Yes, I did.
Okay,
Yes, I did.
I'd like to give you an opportunity to vote on the motion. Carmela Sandoval, Executive Director of the Sequoia Adolescent Treatment Center, yay or nay?
Yes, yay.
All right, thank you. Thank you, Melinda. Okay, and thank you, Carmela. Pursuant to the agenda, we will now move to credentialing the clinical personnel who will staff this mission. And with that, I turn it to Dr. Thomas Massaro. Dr. Massaro? You are on mute, sir.
I'm here. Thank you, Deputy Secretary. I'm here as the chair of the Medical Executive Committee to offer for your approval the 20-member clinical staff, which will serve as the founding clinical staff of the Gibson Alternate Care Facility. If we can show the list of candidates, many of you who also serve on the Medical Executive Committee saw this list of candidates as you approved them as committee members. We have two groups, one that are independent practitioners that require the credentialing process, and we recommend your approval for a 120 days of emergency privileges. And then we have an additional highly qualified group of 10 individuals who do not require credentialing but are equally important in the service of a facility such as Gibson. I recommend to you your approval for this group of founding clinical staff members, and I'm happy to answer questions if any exist. Are there any questions of me regarding this group? If not, I move that the group of 20 be appointed.
Dr. Massaro has made a motion to credential the initial 20 clinicians. Is there a second?
I second. This is Shauna.
Thank you, Shauna. Melinda, I will now conduct the roll call vote. You let me know if I miss anyone. Todd Winder, Fort Baird Medical Center, yay or nay?
Yay.
Tim Shields, NMBHI, yay or nay?
Yay.
Sylvia Cerna, ASD Director of DOH, yay or nay?
Yay.
Shauna Hartley, Executive of Turquoise Lodge Hospital, yay or nay?
Yay.
Jose Garula, New Mexico Rehab Center, yay or nay?
Yay.
Eric Wheeler, Acting Director of the Long-Term Care Program at NMBHI, yay or nay?
Yay.
Pamela Sandoval, Director of the Sequoia Adolescent Treatment Center, yay or nay?
Yay.
Dr. Massaro, Chief Medical Officer, yay or nay?
Yay.
Michael Jim, Executive of Los Lunas Community Program, yay or nay?
Yay.
And Melinda, in the role as for the Office of OTS, this is Jason Cornwell, and I vote yay.
Very good. You haven't missed anyone.
Thank you. The motion was voted on unanimously and carries. Thank you, everyone. The next item on our agenda is the introduction of the individual who will serve as the hospital CEO. In order to achieve the specialty hospital license, my name is initially on the operator's license for the Department of Health Specialty Hospital. We are going to be transferring this license next week to an administrator who will be able to provide the clinical care and supervision as well as just the administration. And so, Dr. Massaro, may I lean on you to introduce the hospital CEO?
Well, in fact, it's a privilege to be able to introduce Major General Jeffrey B. Clark as the CEO of this new Department of Health initiative. General Clark retired from the Army in April of 2019 after 35 years of distinguished service as a physician, a public health expert, a medical executive, and clearly a patriot. We are very fortunate to have an individual with the experience and talent of General Clark to join the DOH team and to help execute this really significant responsibility that the department is accepting in the Gibson Alternate Care Facility. So I'm not sure that General Clark is with us today, but when we have the opportunity, I hope we will all have be willing to welcome him to our team and recognize the value of his contributions to our country and the department.
Thank you, Dr. Massaro. It's a very moving introduction. And General Clark has done journeyman's work for the state of New Mexico, helping establish not only the Gibson ACF in short notice, but he and George Morgan, who we all know and love, built out the Gallup ACF as well as the Farmington ACF. So we do have an excellent team and an excellent leader at the helm, clinically and personally, to ensure that any patient that comes to the Gibson ACF will get the highest level quality of care. So that being said, I'm glad that he has chosen to join our ranks, because each administrator on the phone knows what it means to uphold your mission for the individuals that you serve. And General Clark certainly is one from among us in that regard. So thank you, Juliet. We see that you've joined. Welcome. We are currently on item number 6 on the agenda, other items as necessary. Are there any other items that a member of the board would like to discuss at this time? Hearing none. Is there any
Jason?
Yes.
Yeah, this is Joey. Not a member, but I just spoke with General Clark. He said he'll be on and to introduce himself in a couple of minutes.
Excellent. Great. Okay. So I'll go slow. Other items as necessary. Are there any?
This is Megan. I apologize for jumping in, and it's nice to see you, Ms. Sullivan. Can you tell us when you joined? You may have been attending, but not by video.
I apologize. I just barely called in.
Very good. Thank you.
Okay. Odette, is there anyone on the public, anyone of the public who would like to make comment?
Hi, good afternoon, Mr. Cornwell. This is Leonard Granados at the IT department. And looking at the list, there doesn't seem to be anybody from the public right now.
Thank you, Mr. Granados.
You're very welcome.
I can see that Major General Clark has just joined our group. Welcome, General. We just finished item number 6 on the agenda, and we introduced you as the hospital CEO for the Gibson ACF. We reviewed the brief that you prepared for the ESF6 group. So this body has learned what the Gibson ACF is, how it fits into the local system of care, the scope of patients that we will try to serve. We have credentialed all of the providers who will be fulfilling that initial mission. And then we have introduced you, sir, as the CEO of the hospital. This group has all the directors from the other DOH facilities as they serve as members of the governing board. So I'll go through them quickly, and then we'll turn it over to you to say a few words. We have the executive director of the Fort Baird Medical Center. It's a long-term care facility, Mr. Todd Winder on the phone. We have Mr. Tim Shields. He's the executive director of the New Mexico Behavioral Health Institute. This facility has a long-term care program, an adolescent program, a forensics program. It's a very complex operation, and Mr. Shields joined us just last month. We have Sylvia Cerna. She is the acting DOH Administrative Services Division Director. We have Mrs. Shauna Hartley, the Executive Director of the Turquoise Lodge Hospital. She's on 1st floor, and you're on 5th floor in the Loveless Medical Complex. We have Mr. Jose Garula. He is the hospital executive at the New Mexico Rehab Center. This is a hospital that provides rehab services in the southeast portion of our state. Derek Wheeler is on. You know Derek well. He is the acting director of a long-term care program at NMBHI. Mrs. Carmela Sandoval, she is the executive of the Sequoia Adolescent Treatment Program, a program for offender youth. Dr. Massaro, whom you know. We also have Michael Gem. He is the executive of the Las Lunas Community Program, a home and community-based program for individuals with disabilities. And Mrs. Juliette Sullivan, our leader at the Veterans Home, a long-term care program for our veterans. And you know me. And so, General, I'd like to turn the microphone over to you for a few moments to address this body and introduce yourself, sir. Over.
Yeah, Jason, thank you. And thank you to everybody. That's an incredibly impressive group of list of facilities. And what y'all do is I tip my hat to you. I've run facilities, and the folks that you're caring for in the facilities that you run are incredibly complex. And I'm thank you for letting me join this meeting. So I think I'm Jeff Clark. I'm a family physician. I have an MPH. I retired from the Army last summer. I retired as a Major General. My last 15 or 20 years were executive medicine. I was a director at Walter Reed. I commanded Landstuhl Regional Medical Center in Germany. I was the Europe Regional Medical Command commander. I directed the National Capital Region for about 5 or 6 months that had Walter Reed and Fort Belvoir community hospitals, outpatient clinics, ambulatory care clinics fell under the region. And then I served as what would in essence be the chief operating officer for the Defense Health Agency, which is really oversight of the military health system, and served in a similar role for Army medicine, which is just limited to the United States Army and its 400 and some odd facilities and so forth. Started volunteering last fall, actually, with HSD and Secretary Scrace, and then had the opportunity to stand up our alternate care site initiative. We're working with George and National Guard and a bunch of other really smart folks, essentially working for Chris Emery under DOH. So we set up an alternate care site in Gallup, which we ran for several weeks. The Gibson facility, we did some modifications through the Army Corps of Engineers, and did a lot of the basic beds and those kind of things, had it postured in case we needed it. Didn't think we were going to need it, and then obviously things changed, and the decision was made to open Gibson as an alternative care facility within the city of Albuquerque. We started, golly, George, Jason, I guess we started on a Saturday in mid-November, 14th of November, somewhere in there. And then we actually took our first patients a week later. And so we're about 2 weeks from the time we started until we stood up. I think that's sort of the key piece, is that an alternative care facility is basically stood up for a set period of time. I think if you've seen the brief, you kind of know what our scope of practice is and what our scope of care is. Really, is COVID positive, minimal care patients that right now are coming from the hospitals and just aren't ready to go home or don't have a secure place to go. And then they come to us for, thank you for that. They come to us for anywhere from 3 to 7 additional days of oxygen therapy. And we kind of basically make sure they continue to be stable, and then we do the last part of the discharge planning for their home O2 and a lot of those kind of things. A lot of that's been begun. It was started by the hospital they originated in, which is Lovelace and Prez and UNM. And so that's basically who we are. It's different than the other facilities out there. Because the idea is that this will be a short-term we don't really know how long, but based on the way things are looking as far as the pandemic goes, I think well through January, maybe in early February. I think I'm speculating here. Dr. Fauci could probably give a better answer to that than I can, but something in that realm is how long we think we'll need to do that. The other piece, and I hope this is relevant. I hope this is relevant to y'all. But the first couple of slides on that brief, I think, are important because the ACF needs to fit within the system of care for the city of Albuquerque. We're not a stovepipe off on the side. And so, as an example, we had an hour-long talk with the medical shelters today, leadership of the medical shelters, about which individuals should go to the shelter and which individuals should best be served at the ACF, so that we're square on that. And then and we had a talk, we met yesterday, and we're having a follow-up meeting on Tuesday with the leadership or representatives from the 3 hospitals, the city, the emergency management center, the shelters, to see how we best fit within that system and which patients should best come to us within the spectrum of care. And so there's folks that clearly need to be in a hospital. Within a hospital, there's individuals need to be in an ICU and a med surge. And then there's folks that probably don't need to be in a med surge ward proper, but where's the best place for them to go upon discharge, et cetera. And we think we fill that niche. That's sort of what a ACF does. And so we have daily meetings Monday through Friday with the care coordinators from the 3 hospitals in Albuquerque, and the shelter folks have joined that call. And so we'll be having regular communication, collaboration meetings to see how we can make sure that we're doing the best we can for the most folks within Albuquerque and beyond, if necessary, as we work our way through this pandemic. So, Jason, I'll pause there to see if there's questions.
Any member of the board have questions for General Clark?
Sir, welcome to the impressive resume.
Hey, thank you. Thank you for that. Very kind.
Okay. Thank you, Juliet, for that. I'm hearing no questions for the general, no questions on the ACF, and having moved through the approval, the recognition of the ACF being accepted as a DOH facility, having successfully credentialed the clinical staff, and having introduced the hospital CEO. We have gone through other items as necessary. There were none. There were no individuals open for open comment or public comment. Does any member of the board seek to move to closed executive session at this time?
I do. This is Shauna.
I second. It's Michael.
You move to go to executive session?
No, no.
I'm sorry, Shauna, can you clarify your motion?
I move to close the meeting.
Okay.
That's
Okay.
what I seconded.
Okay.
I was on our way back.
Executive session, really? I don't think we've ever done that before. Okay, here we go. Hearing no motion to move to closed executive session, there's no need to reopen. I will accept the motion to adjourn made by Shauna Hartley of Turquoise Lodge, seconded by Michael Jem of LLCP. Melinda, I will conduct the roll call vote. Tim Shields, executive of NMBHI, yay or nay?
Yay.
Sylvia Cerna, yay or nay?
Yay.
Juliet Sullivan, yay or nay? Juliet, yay or nay?
Yay.
Jose Garula, yay or nay?
Yay.
Eric Wheeler, yay or nay?
Yay.
Carmela Sandoval, yay or nay? Shauna Hartley, yay or nay?
Yay.
Dr. Massaro, yay or nay?
Yay.
Michael Jim, yay or nay?
Yay.
And Melinda, this is Jason Cornwell. I vote yay.
Mr. Secretary, I did not hear Carmela Sandoval of Sequoia's vote. Did she vote?
Carmela Sandoval, yay or nay?
Yay.
Carmela voted in the affirmative to adjourn. Melinda, did you capture that?
Yes, I did.
Thank you. Okay. The motion was unanimous and carries. We shall adjourn this meeting of the governing board at 1:42 p.m. Friday, December 4th. Thank you, everyone. Please do what you need to do to protect your staff, your individuals, your families. We're going into another weekend with case counts, hospitalizations, and deaths all on the rise. Many of us have rapid responses that are taking place, like the rest of our state. Be careful and do your best. And if you need anything, reach out to any member on this board, and we will circle the wagons to bring you what you need. Thank you all very much. The meeting is adjourned.